Take a look at this photo. This one is from Latin America. This is a 5-star hotel right on the waterfront, the ocean front, very beautiful in the Dominican Republic and Santo Domingo. But what's the reaction when we look at a photo like that? We think that one of the big problems is that everyone looks at that and says, what idiots. Look at this guy. If this guy stands up for any reason, this guy is going to plunge to his death. And the tendency is to blame the worker and to say, well, you know, why are they working like that? What idiots? Are they stupid? You know, not wearing their hard hat. That scaffold's not safe. But really, we should be saying, well, hang on, who's the client? Who's the client for this 5-star hotel? Where is the planning? What happened at the bidding stage? How did they get a prime contractor who's using scaffolding like this and putting workers' lives at risk? So we want to, when we have such a fragmented employer base, it's extremely important that we start from the design and the procurement stage, the bidding stage, to contemplate the planning and the budgeting of prevention of hazards. By the construction phase, it's already too late to have very profound influence over the working conditions. The money is not there. So if accidents are a problem in the construction industry, as we've heard from the agency, for example, work-related ill health is pretty much invisible, and it's a vicious cycle of not recognizing the occupational origin of the disease that means that there's very little done about prevention. And in construction, because of the high mobility in the sector, particularly diseases that have a long latency period, are not recognized as being occupational. The big problems that we're working with a lot with our trade unions is on deafness, skin problems, long-term pain from musculoskeletal disorders that's putting so many workers out of the industry, and more seriously even the premature deaths from respiratory diseases and cancers. Asbestos alone, and I want to develop this a little to talk about asbestos, is killing around about 100,000 people every year, most of whom worked in the construction industry. So typical work in construction in India, for example, where this photo was taken, means that you're living on site. About 30% of the workforce are women there, but all laborers, in this case with 16 bricks running up and down all day, living with her whole family and her children on site, exposed to these hazards 24 hours a day. I'll give you our website later, and maybe I'd like to invite you to take a look at some of the materials we have there, some on women, on musculoskeletal disorders, and so on. But a lot of work on occupational cancer. Mainly there, we're looking at dust and fumes, and specifically on asbestos. Here's a photo, again, from India. In this case, it's Russian asbestos that's arrived there. We have a big campaign in the BWI on banning asbestos and on protection of workers who may be exposed to asbestos that's already installed. And we're working very closely with ISSA on this campaign, and we want to develop that work more at national level where it's really needed. What's concerning all of us about globalization of the asbestos market is that if you look at 1975, when asbestos production was at its peak at almost 5 million metric tons, nearly all of that was used in the industrialized world, and very little, some in the former Soviet Union and in South Africa. Today, we've come down to less than half, about 2 million metric tons of chrysotile asbestos, but the market has completely changed. Now that we've seen the legacy of mesotheliomas, lung cancers, and asbestosis in the industrialized countries where we made heavy use of it, is banned. And now the chrysotile asbestos market is targeting the developing countries to maintain and to develop their markets there. In India, since 2004, it's more than doubled. It was 172 metric tons last year, 348,000 metric tons. It's inevitable that there will be an asbestos diseases epidemic in India in 20 years' time. Canada I think we think of Canada as being a real beacon of civilization, but they are running around the world with the Chrysotile Association leading this global marketing campaign. Here you see the setting up international scientific symposia, this one in Jakarta in Indonesia, heavy user of asbestos, and they are hampering progress towards bans that have been made by social security associations, trade unions, contractors in the developing countries by confusing people and using doubt science to try to pretend that it's all okay. It's also Brazil, a big exporter, spent millions and millions of dollars on a huge advertising campaign to pretend that chrysotile asbestos is safe. And perhaps the most flagrant is Russia, who's the largest producer and exporter of asbestos, and they're actually saying that chrysotile asbestos saves lives. So we have a lot to do. And we're working very much at national level using the National Programme for Elimination of Asbestos-Related Diseases from the ILO and the World Health Organization. And ISSA was involved in developing that, and so was the BWI. And so we're really